A lateral lumbar fusion is a surgical procedure that is called to a lateral, as the name says, approach to the spine, primarily going through a muscle called the psoas. After we cut the skin, which is a small incision that allows it to place a tube, everything is done through a tube. There's no muscle cutting. We go through a psoas muscle that even though we don't cut, it could get swollen at times. It's a surgical technique that allows us to do a lot of work through a minimal invasive approach. The indications are limited. Not everybody is indicated for this procedure. Ideally, it could be done as what we call a standalone, without rods or screws. However, certain conditions need to be supplemented with rods and screws. The approach is done to the side. It takes an hour or two, depends on the number of levels. Patients go home usually on the second day. For 3 months, they can walk as much as they want. They could swim at 2 weeks. They can do stationary bike at 2 weeks. No bending, lifting, twisting for 3 months. After 3 months, once we make sure the healing has occurred, then we start physical therapy to go to the next level. Between 4.5 and 6 months, we let patients return to normal physical activities that they did before they developed this problem. When screws need to be added, the recuperation is still the same, although because another incision, the beginning could be a little slower. But at the end of the day, at 3 months, physical therapy is also started. We're happy to evaluate your case. We're happy to see you, and if you're a candidate for this, and if you choose us as your surgeons, we'll be seeing you, and after surgery you can call us anytime or see us for any concerns or questions.